Hey, what's going on, everybody? It's Kenny Lamons here with Mr. Ethan Gladwell. We're the Medicare Millennials, and we've been talking about releasing a video that is just the agent guide and breakdown on the Medicare Advantage open enrollment period, or just what we kind of call OEP. This is the time period that follows right after AEP. It's about to start here in a couple of days, and we want, whether you're a prospective agent that's thinking about getting into the business, or if you're an established agent that just wants to crush this relatively new open enrollment period, we want to go over with you what it is, how to take best advantage of it, what our goals and tips and tricks are for this period, because it really is my favorite time of the year. So what's going on, Ethan?
Hey, what's up, Kenny? Yeah, great introduction there, guys. This is, stay tuned for this one. This is, like Kenny had mentioned, one of our favorite times of the year. We believe this is the time that most agents kick up their feet and relax after a good AEP, but we'll kind of talk about why that's a good thing for you here shortly. So stay tuned. We got a lot of good stuff coming your way.
So Ethan, I figured we'd just start out first things first, so everybody watching knows what we're talking about. Last year, really this year, 2021, was the January 1 through March 31st, 30th, 31st, whatever,
I think so.
Was the first Medicare Advantage open enrollment period. So we are now, right?
I thought it was 2020 was the first one. The first one when we hopped in. That's because we did our first AEP 2019 and then OEP of 2020.
I think you might be right. So let's say this is a third one.
Okay.
And it's different than that time frame was in the past, which we won't worry about the past. Just give me a definition for a newcomer on exactly what that open enrollment period is.
What's that?
Just for us as agents.
Oh, okay. Yeah. Medicare Advantage open enrollment period is a really special time. There's a bunch of different nuances on what you can and can't do, which we'll kind of dive a little bit deeper into that here in just a minute. But really, I believe what it was created for, it was created for folks that either switched their Medicare plan from another Medicare Advantage plan, they switched from a supplement or original Medicare to Medicare Advantage. So really what it was originally intended for was for anybody that maybe switched and made an error so they don't have to ride with that whole plan for the rest of that year. Or if somebody switched in error, they got bamboozled, whatever the situation may have been, maybe didn't understand, where they could get out of that Medicare Advantage plan and back to original Medicare. That's a real broad overview of what Medicare Advantage open enrollment period is.
Yeah. So in a way, it was kind of like a mulligan, right?
Yeah.
Because the annual election period is, you're allowed to advertise the crap out of that. Like the whole world wants to let Medicare beneficiaries know this is their time to make an elections. You want to go back to original Medicare. You want to go from original Medicare to Medicare Advantage. You want to make a change from one Med Advantage to another. Loud and clear. Everybody's advertising to you from October 15th to December 7th to do that. But what happens is a lot of folks will do that and they'll end up on some type of Medicare Advantage plan that they are unhappy with. They made a mistake. Maybe they didn't get swindled, but maybe they were misled, or somebody left out some crucial information where now their medicines aren't covered. They're just not happy. Well, why do they just have to be stuck for the rest of the year? So this is for people on Medicare Advantage only, this specific enrollment period, to be able to make a change within other types of Medicare Advantage plans to get set up for the rest of the year to be happy with.
Bingo.
So, I hope that's kind of two sides of the same coin that we just described there. A couple of things about it, and then Ethan, what I forget, you just remind me of. It runs from January 1 to March 3rd, the end of March. Okay. It's only this election, you can only use one time during that 3-month period.
So if somebody's already used it, you run into somebody in March and they've already used that OEP election, which we can kind of talk about how we'd know that without, of course we can call the carrier, but there's another way to do that as well. So if somebody's already used that, you cannot use that again. CMS will not approve that.
Right. So one time for that specific SEP, that election code, you can use it one time. You can go from a Medicare Advantage plan to a different Medicare Advantage plan. So what if somebody has an MAPD, and they just give me yes or no, MAPD, so a Medicare Advantage plan with drug coverage included, can they go to an MA only, so a Medicare Advantage plan with no prescription drug coverage?
Yes.
Right. Can they go from MA only to an MAPD?
Yes.
So, yes, they can. Can they go from they only have a PDP, prescription drug plan, to a Medicare Advantage plan?
No, they cannot.
No.
I think I just asked you that the other day too.
Yeah. And we've only found this out the hard way because we weren't smart enough to study all. It's hard to memorize all this till you've done it.
It's a lot.
Can they go from a Medicare Advantage plan, say, I don't like this crap, I want to go back to original Medicare?
Yes.
Yes, they can.
Absolutely.
Can they go from one prescription drug plan to another?
Oh, no.
No.
Okay.
And can they go from original Medicare to a Medicare Advantage plan?
No, they cannot.
No. Okay.
Not on the OEP.
So let's dumb that down. You answered pretty much everything right. Hopefully we didn't make a mistake. We don't, this sad that we have to make this disclaimer, but we didn't author these elections. Okay. This is just the best of our experience. We may make an error or misspeak on some of this stuff as we go.
Feel free to correct us in the comments as well.
Yeah,
we're more than happy to see
that. But just to dumb that down, it's essentially if they already have a Medicare Advantage plan, they can make a change.
Yeah.
I mean, just start there. If they have some type of Medicare Advantage plan, they can make change. That's a lot of people.
Yeah. Yeah. And in fact, guys, this is where I think that you find your most loyal clients, because what I have found in the past is, let's say somebody's had the same plan since they were 65. Let's just assume they're 72 at this point. They've had the same plan. They eventually get persuaded to call the 1-800 number, or somebody could have came by saying, it doesn't matter. And they switch that plan. They go January 1 with their new plan to the pharmacy, to the doctor, whatever it may be. And let's say that drug was free at one point, but all of a sudden it's now $22 or something like that because somebody promised more dental or whatever it might be. So they're going to panic and they're needing somebody's help. They don't know that they can go back to the plan that they had or another better plan. They think that they're stuck for the year. So I think the most important part of OEP is the loyalty that you're going to create when you go save that person, because they're never going to make that change again without your assistance. I mean, have you found that to be true?
100%. So let me rephrase that. The way I look at MAOEP, again, I just refer to it as OEP, is a bunch of people screwed up. They talked to some call center. They decided to make a change. They didn't even realize they were making a change.
Yeah.
And then they're like you said, they need saving. They're like, holy crap, can't see my doctor anymore. Prescription's not covered. Nothing's working. Never heard from that call center agent again. Like, they're just in panic mode. Here comes the savior. That's what we're here for. We are here to help you. Now, so that makes it great. You're getting loyal customers, love this time of year. However, it's very important to I'm not the, what do you call it? What's it called when you compliance police here? But one of the main things, the first thing they told us as agents, you can't go out there and blatantly advertise MAOEP. Right. You couldn't send out a mailer that said, Kenny Lammons, local agent here. Did you know right now you can make a change because of the MAOEP period? So I guess I understand why they don't want you doing that. But really what you can do is just send out your regular generic advertisements that you normally would, just about, hey, are there better benefits available to you? Whatever you typically do on your mailers or Facebook ads, that's a more generic advertisement. That's not specifically pointing out, trying to get them to use this MAOEP.
Right. And
people are going to respond more than normal because they're in that panic mode. So but you can't expressly put that MAOEP and splatter it all over the wall and use that on your advertisements. Am I right there?
Absolutely. In fact, an agent had reached out to me the other day and asked, asked several times right before AEP and now right before OEP, what lead piece that I'm using. And I told him it's the exact same one that I've been using all year long. We tweaked the demographics a little bit as far as income, but other than that, no, it's the exact same lead piece because it works.
So let's keep on moving on this, because we've kind of covered what it is, what it's there for, who you can help. But you just made a good point. We tweak the income and different things, right? So I'll preface it by saying sometimes during the year, we don't have these normal enrollment periods. So we focus on the lower income that probably have like LIS or Medicaid, so that we can still generate new business when there's not these open enrollment periods.
Absolutely.
Do we need to focus on low income during OEP, January through March?
No.
Why is that?
I don't think Medicare Advantage is specifically for lower income folks. I think middle income and even upper income. I've got a veterinarian client who makes $1 million a year. He also has a Medicare Advantage plan. So we don't have to target income there. We can just target really just anybody.
Yeah, just that general broad audience. And if we go visit them and it's during OEP, they haven't used the election yet, they have some type of Medicare Advantage plan, we can potentially help them using this election. Yeah, so it keeps it nice and broad. So that's important to know. So let's talk about leads. You kind of just touched on this already, are you doing anything special, or are we doing our boring old direct mail campaign that we always do during this time?
Boring old campaign. I can't push it enough. At our point in our careers, Kenny, I think you would agree that we want the highest intent lead that we can buy. Sure, we'll pay more for it. Sure, we'll wait a little bit longer for it. But at the end of the day, I personally don't want to call hundreds and hundreds of leads to book me a week. I would like to call as little amount of leads as possible and book me as many leads or book as many from those leads as possible. So that intent is high, and we've just found that the highest intent is with direct mail. So we're going to keep using that old busted thing that works.
Yeah. And so the piece that we use, it's not some secret. We didn't invent this lead piece. If you ever worked with us, our FMO will mail this lead for you. If you don't work with us and you do a regular mail house, anybody's going to have a similar piece to this. It is a direct mail lead it's actually kind of geared towards low income in a way, because it talks about making sure if you qualify for any extra help to help pay for your medications. Also talks about if you qualify for any of the extra benefits like dental, vision, hearing, transportation. And so if you're wanting to see kind of that exact lead piece, you can and you want to work with us, you can reach out to us or just call any mail house and say, hey, what's like your most popular Medicare targeted kind of extra help, extra benefit lead piece? And they're going to show you this, okay? Because we didn't make this up.
And it's very important that I think we've discussed this in other videos, Kenny. It's very important on the lead piece. You want to cast a broad or a wide net. You don't want it to be too niche down. I think we've done a chronic one before. T65s is another good one. When you really niche yourself down, especially during OEP, when you're like trying to gear up and write volume business this time of year, you really don't want to niche down your lead piece. You want to cast a wide net. You're going to get people when you call them, say they weren't on Medicare or not on it yet. You're going to get people that say whatever. You're going to get people that say all sorts of different things, but ultimately you're going to get a better return, and that's going to give you more of more chance at selling people.
Harper, can you hear that?
Nuh-uh. I just hear everybody upstairs
asleep in here, and he's like snoring really loud. So that's my dog.
Yeah, but cast a wide net, as wide as you can. I mean, you don't want the lead piece to sit there and ask 16 different things, but I think you'd mentioned ours does 3, right? So somebody may not be interested in more dental or vision. Maybe they're fine with that, but maybe they're paying $47 a month for a tier 3 drug, and they want to see if they can get a little bit lower price on that. Find something that somebody will want.
Mm-hmm. Yep. And then the only thing that we really tweak about that direct mail campaign is that we ask that it be sent out you don't limit the income range. Just crank that income range up, whatever you're comfortable with, 0 to 50, 0 to 100, because if you're targeting low income in June when there's no other election periods, you may only have it like 0 to 25, 0 to 30, because you want somebody that will qualify. But right now that doesn't matter as much, because if they've got Medicare Advantage at all, we can help them. So let's talk about real quick commissions, because during annual enrollment period, agents are like, oh my gosh, I got to go all the way from October until like mid-January before I get paid for anything that I do. And this is assuming you don't have renewals yet. You're not selling like a whole lot of life insurance or anything else. You're just getting started on Medicare Advantage. So like whether you sell 20 policies or 200 policies during AEP, it's tight. I mean, it's still to this day, we always kind of joke about it. It's like we're not really getting paid what we're used to during this time of year, because all you got is your renewals.
Right.
Is it the same way in OEP where you kind of have to wait, you start selling and then you wait until after March to get paid on all that?
Absolutely not. Or even the following year. No, absolutely not. OEP is special because it is prorated. And so I guess what I mean by that is if you sell something in January for an effective date of February, you're only going to get 11 months of that commission because, you missed January, and then, so on. So if you sell in February for March, et cetera. But no, typically, I think you had mentioned this right before, Kenny, you get paid usually after it's approved the next pay cycle. Is that right?
Yeah. So, but from most carriers anyway that I've dealt with, first of all, this tells you how much I don't obsess over commissions. Right here in Texas for this year, for the new commission, it's $287. $287?
Yeah, I don't know what the new to Medicare 5 or something.
No, forget about new to Medicare, because we're talking about switching someone from one Medicare.
Okay, gotcha. Yeah, 287 divided by 12.
It is 287? Okay.
Yeah, I believe so.
Shows how much I know. But whatever that amount is, okay, that's the annual payment that you would receive for 2022 for the whole year, right? If you had written someone in AEP. So if Ethan goes, he receives a lead and they're like, hey, come out and talk to me. He goes and talks to him. He puts them on a plan that fits better for them on January 10th. That plan, this is important too. It takes effect February 1st, not after the whole enrollment period's over, right? OEP goes from January to March. So it's not like it's the first day of the following month of when you do that application.
Yeah.
Okay. So plan starts February 1. So you're going to get 11 months of the total commission advanced. And so that's going to be 11. If you want to do the math, we're not going to do it right now. 11 divided by 12 times 287. 11 over 12 times 287. That's like whatever, 250 something bucks. Okay.
Yeah.
And then you'll get paid on that as soon as it gets approved. So like if it goes outbound to CMS, won't get into all that. And then you see like it's approved. This plan starts 1/1. Most carriers will pay you whenever their next pay cycle is, like a week later. It's not even February yet. You're getting paid on this business. So
yeah,
this is the time of year when you can get almost a full year commission a few days after you sell a policy.
Yeah, it's a super
now,
good
some
time.
carriers only pay monthly or whatever, so that may be their pay cycle, but a lot of the big carriers, they pay like twice weekly or whatever it is. And so you're writing 10 policies, like you may be getting paid on 7 or 8 of those that week. And then just boom, 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 boom. And to further explain the prorated thing, that continues through the rest of the year. In most cases, if you're using an SEP to switch somebody from January through September, it'll just be that 287 prorated by the amount of months left in the calendar year.
Yeah. Yeah. So the further into the year that we go, the less that you make. And then this kind of segues us into the more important it is to do your HRAs or whatever they're calling them. Every carrier calls them something different, but it's extremely important to include those because that's an extra 50 to, I think somebody went up to 100, right? Extra 50 to 100 bucks per policy paid the month after the effective
usually
date.
That's paid like a full everything in January. They'll kind of pay all the HRAs that you did out at the end of February. So they're kind of behind, but it's like a nice bonus.
Yeah.
And all that is, guys, he's referring to is a lot of Medicare Advantage carriers are now allowed to pay an agent to go through a short, like, health risk assessment. That's what HRA stands for. Some people call it member care assessment, MCA. All it is like every policy, right? If that carrier offers it, you just simply ask them like a set of health questions that helps the carrier, I guess, kind of determine what their health is and the risk that they're at for different things, and they're going to pay you a bonus for that. So if a carrier does that, this is a great time of year to capitalize on those.
And they don't prorate that, do they? Like throughout the year?
No, if it's $50,
guys, if you're writing 40 policies a month at $50 a pop, that's an additional $2,000 bonus a month. I mean, we're talking $24,000 a year. Mm-hmm. I barely made that my first year in insurance. I mean, that's huge money. I mean, and we didn't even know about that our first AEP, Kenny. So we both lost out on, whatever that number may be. So extremely important there to know.
So are there any specific, I think we kind of went through most of the enrollment rules, the marketing rules, anything that we can't think of, feel free to spit out. But how about on top of anything you can think of to add to OEP? We love this time of year, guys. It's a great time for you to get started. Here's one. All those contracting restrictions that happened during the blackout period, those are all gone, right? So like a lot of carriers, dude, after like June or July, if you already have, you can't switch to another FMO. You can't. There's all these different rules, like pretty much starting in January. If you've been watching me and Ethan's videos and you're like, I want to work with whatever they're doing, I want to go with their FMO. You could do that during OEP. We can start making moves, or even if it's not us, my point is there's nothing stopping you from becoming a new agent. There's not near the pipeline bottleneck for new agents trying to get contracted. That goes faster.
The processing is much faster.
Transferring your contracts from one upline to another because you want to be in a better position is a lot easier. So no bottlenecks there. But outside of that, like, what else would you share? What are some tips or strategies, or just maybe some of our goals, your particular goals that could help another agent maximize this time of year?
I've talked to a lot of different agents here in the last week and a half here. I've heard a whole bunch of slew of stories, anywhere from somebody being brand new and just watched our first video all the way up until I just talked to a gentleman yesterday that worked at a pretty famous call center and just absolutely smashed it and is ready to become independent. So I guess what I'm trying to say at this point, guys, is like Kenny had mentioned a minute ago, this is the time to make your moves. We're not trying to push anybody. We're not trying to do anything other than just encourage you guys. Like, if you've been thinking about going independent, you've been thinking about getting into the business, this is one of the times. Although Kenny and I are still writing a bunch of business personally, we are taking phone calls. We are talking to agents. We are making sure that you guys are getting your questions answered. And so I just wanted to kind of share that. One other thing completely off that topic, I just hear everybody talk about OEP. It just drives me crazy. People talk about OEP. In fact, I've heard FMOs doing this, and they're like, hey, we need to be hitting 70% of our AEP goal or 75% of our AEP goal. I mean, Kenny, I know our first AEP was very rough. We didn't really know what we were doing. I wrote 42, you wrote, I think 50, something like that. And then OEP, we lit it on fire because we figured it out and we wrote 150. My point here is you have more time. I think we got 3 months, whereas, AEP had like a month and a half or whatever it may be. So you've got 3 months, you've got much, much more time to write. And these people aren't expecting you to be able to switch them or help them or anything like that. So walls are down, marketing costs are down, returns are higher, you have more time. You now know kind of what you can and can't do from this video. Guys, there's nothing left to do except get out there and kill it.
Go to work. Yep.
Go to work.
So just throwing out a couple of tips here. If this was your first AEP, or even if you've been in the business a whole year, a few years, just remember that MAOEP is also a time to retain your customers. Yeah. All that new business you wrote, you need to be following up. I've already sent one postcard since AEP ended. I'll send another one here in January with just a picture of me and my family, my phone number, just reminding them, hey, I'm your agent. you know, if you become unhappy with something, if you struggle, if you have a question, call me first. You know, let me try to help you. And then I want to call them and touch them, especially if you only have 50, 100, 200 clients, call every single one of them, because that's not as big of a task until that number gets bigger. My point is, you also don't want to lose everything out the back end, right? So solidify your business. Look, you sold someone during AEP and they call you and they're unhappy, or you forgot something, they didn't tell you about a prescription, you may need to go back and use OEP to fix that problem. That's okay. You'll do that less and less over time. But for now, retain. We want to build a long-term book of business. And the other thing I would mention to you guys again is quality over quantity. We want both, okay? But I'm just not the guy to come blow smoke up your butt and say, I would rather an agent come on and only sell 100 policies that first year than them come on and write 500 policies their very first year, but with no regard to trying to nurture their clients, generate referrals and things like that. I'd rather you write 400 or 500 and really put an emphasis on nurturing your clients. That would be a perfect world.
Yeah.
But my point is, like, quality, you're looking for clients that really want, you really can help them, and you follow up with them. You send them like an easy postcard using a service like Vistaprint. You stay in front of them. Man, our referral business is just booming right now. And it's the only thing that blows a direct mail lead out the water, which is when people are calling you. And that comes from, you know, calling them during OEP and reassuring them that you're there for them. So
excellent point, because guess what? Maybe you're not the only agent out there working OEP around your clients and things like that. There's somebody else out there waiting to help them out. Maybe they didn't know you worked for all the carriers, so you put them with whatever carrier it may be, and so it didn't work out for whatever reason. And so the first person that calls them, they can help them out and get them switched. Guess what, guys? You will get a chargeback, and you'll get the full chargeback. Correct? If they disenroll, it's the rapid disenrollments within 3 months, you get the full chargeback.
Yep.
So you certainly want to hold on to that, because you don't want to get this nice check in AEP and then have to pay a part of it back because you didn't send out a quick voicemail or a text message or a postcard, whatever it may be. Don't make that error, because I personally have, and I tell you, it's not that much fun. It's easier to retain.
Well, hey, look, Ethan, I think we've mostly covered like the broad things about this. If we get enough comments asking more questions that we didn't cover, maybe we can do a part 2 like next week or something. Otherwise, look, me and Ethan are agents first. We're building an agency that we take a lot of pride in our customers and having our own book of business that we put our own blood, sweat, and tears into. However, we do also coach and recruit agents to our FMO. And so we are available here to give you guys guidance, or reach out to us if you think we might be able to share the opportunity that we're taking advantage of. But even if you just want to reach out and ask us questions, that's cool too. Anything you want to add before we wrap up?
No, I think I've hit it, guys. Just get out there and crush it. It's a good time of year.
Happy selling, guys. Happy New Year. Don't drink and drive. Be safe.
We'll see you on 2022.
All right.